Good morning, everyone. It is finally Friday, November 12th. Welcome to the Morning Medical Update this morning. Thank you for joining us via Facebook and YouTube. Well, imagine you're a parent who has been waiting nearly a year to get your child vaccinated. They get it, but they're still in school with kids who have not had their shot. Yep. Now we are faced with mask mandates in schools being lifted. So what now? We're going to talk with an expert advisor to many school districts in the area and hear his advice and just where schools stand and how they're handling all of this right now. So make sure you get your questions in to us today. You can send those via YouTube, Facebook, Twitter, and the Medical News Network. You can find those links right there on your screen. But first, let's get to Doc Hawk on this Friday. Good morning to you. Hi. Any updates on the numbers? Any good news?
I'm glad it's Friday.
That is good news.
I guess the good news is that the hospitalization numbers are really about the same. They have been the same now for about the past week, in that mid-teens. We have 16 active infections, although we do now have 7 ICU patients, only 1 on the ventilator, so that is a good thing. 22 additional patients meet that recovery criteria, and we should state that of those 16 active infections, none of those patients are fully vaccinated. Also, Hayes has 5 active infections and 7 in that recovery period, for a total of 12 as well.
All right, thanks for that update.
Sorry to interrupt you, but I think this goes to what we have been talking about now for quite some time. Although our demographics and the people that we do get in the hospital are a little bit different because we do have high percentages of immunosuppressed patients. But as we can see here right now in those 16 active infections, none are fully vaccinated. So we do have this pandemic of the unvaccinated as compared to the vaccinated patients.
Which we've been talking about this whole time. All right, thank you for that update. Any reporter questions on the line? Okay, I do have one from Donna over at Channel 9. Thanks for sending this in, Dr. Hawkinson. Have you ever heard of shot detox? Have you heard of it? And what can you tell us about it?
I heard about it this morning. Apparently, it is people who don't want to get the vaccine, who are hesitant or just not wanting it. They get the vaccine, and then now they believe, or there is groups of people who are promoting a way to then counteract what the vaccine has been doing or what the vaccine is going to do. I think mostly it involves some sort of bathing, maybe with borax, a potentially caustic and harmful substance. But again, there is no science, no truth to that. You get the vaccine, the components are injected into your arm. They then are taken up by those local muscle sites or go to that local lymph node. That is where really the magic takes place. You have that immune reaction, that immune response. Bathing in borax or other substances will not be a vaccine detox. Again, this is nothing that is supported by science or data or anything of that nature. I think it is just probably people who are out trying to make money. I would also avoid essential oils. We know that those Walmart essential oils have been linked to a number of very significant bacterial infections as well. That is another outbreak that is kind of going on in the United States right now as well. So again, no truth to that shot detox. If anybody was thinking about doing that.
Okay, so I'm just making a note. No bathing in house cleaner, correct?
Correct, yes.
Good. Okay, good mental note today. Okay, next question from Donna. What do you think about Denver's state of emergency to allow anyone to get the booster who's over 18? Is that something you think we should do here? With an increase, as we see an increase of cases, what are your thoughts?
Yeah, I don't know how this would be policed. That would be up to the Colorado Department of Health to really understand what and how that is happening. I think the major concern is not really people who are wanting or getting boosters. It continues to be those people that haven't gotten any vaccine whatsoever. We know that even if you don't get a booster, and especially if you're under 65, you still have excellent protection against going to the hospital, severe disease, and death. And so I'd have to look more into those details. But my concern is not necessarily for those people that haven't gotten a booster. It is for those people that haven't gotten any doses of vaccine whatsoever.
All right, other questions on the line? Okay. go ahead and get your questions sent into us. We're going to get to some today, and then we'll get to some of our follow-up questions as well. Okay, so while people are getting their COVID-19 vaccines, health officials say the country needs to do a better job at getting younger people vaccinated. About 60 million people are eligible for the vaccine but have not received it. But something in our favor is that the opportunity to get nearly 28 million kids vaccinated who just became available. So that is good news. It's going to be interesting to see how schools will handle this effort, which is good news today because we are joined by Kenny Southwick. He is Executive Director of Cooperating School Districts of Greater Kansas City, and he is joining us live today. How are you?
I'm doing pretty good. I hope you guys are doing well.
We are, and we're glad to have you. Perfect timing that you are here because there's a lot of questions about schools and how they are going to handle kids getting vaccinated. Just what part do you think that schools will be playing in this rollout with kids 5 to 11?
Well, first of all, we believed all along that vaccinations, as many as we can possibly get in our schools and community, is the way to get back to normal. So we continue to work with, whether it be a local doctor's office or hospitals or health departments, to coordinate vaccination opportunities for anybody that's eligible that might be in our school system. And that's whether that is our staff, our school board, our teachers who are in the classroom with kids, and of course, any of those students that we have that would be eligible for the vaccine. We know that's extremely important and want to do everything we can to facilitate that.
So you think we will start holding clinics at these elementary schools?
I'm not sure whether it'll be at the elementary school or not, but it would be a coordinated effort. You know, as you all know, we represent 32 school districts. We work closely with the majority of the Johnson County school districts and the Wyandotte school districts too. Lots of individual decisions have been made about what to do and when to do it, primarily following health departments, or in some cases, if that's not available, looking at what the CDC has to offer based upon their individual philosophies. But yes, we already know that they're working with groups like Children's Mercy. I was on the MACG call the other day where we talked about some of the efforts that were taking place. And I was with a group of superintendents on Wednesday that their districts and their medical staff are there and willing to coordinate and help with the vaccination effort.
So Kenny, we're a couple weeks into this age group being eligible for vaccines. Any updates on just how we're doing? Is it as expected? What are the numbers looking like as we come out of the gate?
We look at numbers on our MACG group, which is a group that works with Mark and looks at all the data with COVID and how we're doing and how we can respond. I think the alarming thing for me is this, that we saw numbers that show the 65 and older group, which I am, or well, I think what I saw, over 90% of the people in our area that are in that age group are vaccinated. And you go to the next group, which is the 18 to 64, and that number goes down. And then you go to the next group and you look at the 12 to 17, which it's been available for quite a while, and that number goes down again. And now if that trend follows, we can expect that at least early on, the numbers of elementary kids that will be eligible now under the emergency use authorization will probably be low. And you led into this, that we've got some work that we have to do to educate and convince that that's a population of our community and of our schools that we need to get vaccinated.
So what are your concerns and the district's concerns when it comes to, we're heading into winter, we know that mask mandates are being lifted, some kids are going to have their vaccines, some aren't. Just kind of bring out the crystal ball this morning. What do you think's going to happen, and what are you hearing from districts about their concerns?
Yeah. Well, first of all, thank you for calling me an expert, but I'm going to defer. I've found out through this that I'm anything but. But you know, there's concern right now around vaccination, but also around mitigation practices. First of all, I want to put a shout out to our schools for the work that they've done to get kids back in school. on a regular basis, face to face. We knew over the last 20 months that was our goal of what we need to do, and we're doing it. But it's coming with consternation. There's no question about that. It continues to be an effort for the schools to look at mask mandates and whether or not they're going to expire, and what does that mean when they do expire. I think Jackson County and Missouri right now are going to vote today as to whether or not they're going to lift their mask mandate. And what's that going to mean to our school? Kansas City did that, I think, within the last week or so. And what we saw was that they kept that in place for schools. We'll see what happens after Jackson County makes their decision and if Kansas City follows. I think that's set to expire around right after or right before Thanksgiving. So we know that all the mitigation we've done have kept us in school. Although we've had quarantines, we've been able through masking to keep kids in school. And when we've had cases, been able to limit some of those quarantines having to take place. My personal fear, and it's decisions that the individual school districts have to make, if those mandates go away, and you're not going to find any districts going to say just don't wear masks anymore. They're going to either make it optional, or they're going to make a strong recommendation. But that's one piece of the mitigation that goes away. And with that, I think we know that if cases don't continue to go down and vaccinations don't continue to go up, we're going to continue to have a lot of quarantines that kids missing days of school they wouldn't have to miss.
So I'm curious, my question, I guess, is then why lift the mandates until we have a certain amount of kids vaccinated? Is there pressure coming in from parents? Why is that still an issue? Why can't schools just make the decision? Or districts make the decision?
It's been an issue all along. And what the school districts have done, and what we do in a normal operation, if we would have a case of something in a school, the first thing that we would do is contact the health department. And then they would be involved in notifying families. If families need to be involved, they would be there to decide if there needed to be quarantined. And they would provide us the advice in terms of what our reaction ought to be at school. And that's the normal operation. The difference with COVID has been we've continued to follow all the recommendations of the local health departments, and they're different. Some of these districts span, Kansas City, Missouri, and Platte County, and maybe Clay County, looking north of the river and going south. You might have parts of a county have Kansas City, and part of it just be the county health department. So what the school districts have done, and the boards have based their decisions based upon what are the recommendations and the mandates in their jurisdiction. And it's been difficult. But when we've answered questions to parents regarding why are we wearing masks, our students shouldn't wear masks, or why are we not wearing masks, and they should be, we generally have deferred to, we're following the guidelines of our jurisdiction of our health department. It's difficult now if they remove those for all of a sudden to say, well, no, we're not necessarily going to follow their recommendation. So those are issues that individual school districts are going to deal with. And I'll tell you from past, and I think you know this from watching the media, there's strong sentiment on both sides of this. And no matter what decision that a school board would make, they're going to have people that are not going to be happy with them. It's not a business where you're making everybody happy, but they're going to be tough decisions.
For sure. Yeah, I do not envy the school board members. That is not a place I would want to be sitting right now. I know that is a tough spot. You've got very passionate parents, good parents on both sides, wanting what's best for their kids. I want to talk about something else that has affected kids and schools thanks to COVID. Our supply chains have been halted in many cases and diverted. So let's talk about supply chain and food getting to kids. What are you hearing on that stance?
Yeah, thank you for giving me an opportunity to speak a little bit about that.
Food getting to kids.
We have,
Are you muted, Kenny?
Yeah, I did not do that myself. I was supposed to be in control of that. I didn't do that.
No, that's okay. We got you now. You're fine.
Okay.
Just I want to talk about that supply chain and the food and how it's getting to our kids and how that's been affected and what you're hearing.
Yeah, so I'm going to go back 20 months. And when we met, first of all, as a group of operating school districts, when COVID first started, we were concerned most about if kids go home for a couple of weeks, what are we going to do to get food to them? We thought that was going to be the bigger issue. Well, that proved to be wrong. We have a different food issue now. We were able to feed kids all through last year and all through the summer by taking food to children. But this year, because of the supply chains that we have across the country, our distribution companies, a lot of them have just cut their contracts with school districts. So we're not going to deliver food to you. So that's left the school districts to scramble. We've been working on this for a couple of months now, and we're holding our own. But I think parents out there that might be listening, you're probably not getting that monthly calendar home of meals of what we're going to have for breakfast and lunch and what the side option would be and if there's a dinner meal or a snack. Basically, we're feeding the food that we have on a day-to-day, week-to-week basis and are not able to stockpile in our warehouses maybe like we've been able to do in the past. We're working very closely with Mark and also with FEMA. I'm fortunate enough to serve on the Homeland Security Group. And should this become a bigger crisis where the food chain really cuts off completely, we would be prepared to make requests so that we make sure our kids can be fed. But it's been a major challenge for our school districts with respect to nutrition.
Well, I'm glad you brought that up because that was something that I think concerned so many people when COVID first hit. It was that kind of immediate thing that we were all thinking, wow, there's kids that aren't getting food in their bellies. And that's really not acceptable. And so to think here we are, 20 months later, and it's still an issue. I know you mentioned it. I don't get those papers sent home either. And I look it up online every day and tell my kids, you get what you get. And that's what you're getting today. But to know that, I know you guys are scrambling to make sure that kids that really need food are getting it. So thank you for that. And thank you for updating on that. Another thing is about staff. I want to talk about staff, nurses, teachers, people stepping away from the profession. Where do we stand and how has that compared from maybe this time last year to today?
Yeah, as most of you know, workforce development in the Kansas City area is a prime issue. And a lot of agencies work on workforce development. We're right there with them. As you drive around and you look at storefronts that say we're hiring, inquire within, that's where our school districts are right now. In the past, if we had an elementary position, a smaller district might have 200 applicants for an elementary position. A larger might have 2,000. They're not there now. So we're seeing not only not young people gravitating to the profession, but because of COVID agitating that, we're seeing some burnout. And we're seeing some of our staff that are just walking in and saying, I can't do this anymore. And whether they take an FMLA or whether they actually just resign, or in some cases I've heard have just said, tomorrow is my last day. And these people on contract. And then a lot of the backbone for our school are our non-certified people, our cooks, our bus drivers, our secretaries, our paraprofessionals. All of those people are so important as we provide our service. And we're way down in terms of staffing. And the last thing I would say that's really critical is on any given year, we have to have substitutes in the classroom. And whether we have our own substitute pool or we work with a company that fills those with certified staff members, our rates for filling could be anywhere from 90 to 100% on a given day. In a lot of cases, we're down into the 40s and 50%. So that means you might have 10, 12, 25, 30 staff members that are gone. The only way you fill that is with your existing staff. So we'll have librarians and counselors and principals and assistant principals and any certified support person that we can put in the classroom to be there with those students that day. Obviously, that's not ideal, but those good people are making that work. So that, and again, our teachers give up their plan period. They work their periods. They can have a plan period but they're agreeing to go into classrooms to cover for another teacher. All of that is a stress on the system. And remember, a lot of our systems were out on hybrid or virtual for over a year. So this first semester, students are kind of learning how to come back to school. And it's not the normal routine with everything we have for mitigation and vaccines and all that we deal with. So again, my hat goes off to all the work that they've done to get us to where we are.
Oh,
Almost Thanksgiving.
Yeah, for sure. They're incredible. Schools have done it right, and kids are troopers, and they've done a tremendous job as well. A couple more questions before we get to some follow-up questions today. Just any advice, Kenny, just that you have for parents to prevent kids from getting COVID, spreading COVID, just navigating. Here we are in a new phase, another group getting vaccinated, but there's still so many questions, still such a divide. What advice do you have for parents, just from the way you see it?
Yeah, most of my advice I've gotten from you all, and that is mitigation. You're careful about where you go, and remember, if the mask mandates are lifted, you can still choose to wear a mask and have your child wear a mask. That's important. Seek information out about the vaccine. Feel comfortable about that. Talk to your local doctor. I mean, you guys have said that time and time again. Get your questions answered. I hate to say it, but I don't want to offend anybody, but don't go to the voodoo cookbook. What we want to do is look at science that will keep our kids healthy. And I believe we're going into a critical time where when mask mandates are going to be lifted and we're going to indoor activities. And I don't want to predict what will happen because I don't know. But I think we need to continue to be cautious about what we do. And like I said, remember, if a mandate gets lifted for a mask, that doesn't mean that I'm going to quit wearing my mask or that parents should have their kids stop wearing their mask if that's what they believe is important.
Makes sense. Okay, I'm loving this voodoo cookbook that you just said. That's a good one. I'm going to have to pass that on to Stites. He always talks about the Made Up News Network, so I'm going to pass on the Voodoo Cookbook. Dr. Hawkinson, you know what it's like.
Bathing in borax. So we also, I do have some more information about the Colorado. So it is, the Denver issue with the booster. It is backed by the state and the Colorado Department of Health, and really what their intention is they do continue to understand that the vaccines really do well in protecting you against hospitalization, severe disease, and death. What they are looking to do by offering boosters to anybody is really hope to spread and decrease that transmission in that early time period after vaccination. So that is the main reason behind that as well.
Can anyone just go get a booster? I think we get a lot of questions about there was those kind of tiered, these people go first, these people go second. But I mean, can you just walk in and get a booster? Anyone? I mean, over 18?
I mean, ultimately, yeah, you can. There aren't really a lot of crosstalk or records that are kept necessarily at some of these local pharmacies and things like that. So ultimately, somebody really could just kind of walk in anywhere.
And should they?
Again, I think we have to ask, why are we doing this? And if it's for, again, protection against hospitalization, severe disease, and death, we know that vaccination, even 6 or 8 months ago, continues to protect you, especially if you are in that under 65 age group. There is that thought and that belief that if you are within, say, 3 to 4 months, or those first 90 days after vaccination, that you have high enough circulating antibodies that you are even protected from getting the infection and, of course, spreading it. So there's no guidance for those people, really, everybody over 18 from the CDC and FDA. But obviously, as we have seen here with Colorado, the state has made their own ruling on that.
And as you always say, let's just get people to have one shot. Let's get there first.
Yep.
Okay, so let's get to some community questions this morning. We've got a few good ones. And Kenny Isaac wants to know, if you think back to March of 2020, if we had known then what we know now about COVID, do you think that schools could have remained open or at least reopened sooner?
I don't think so. I think back in March of 2020, our hopes were that we would be back after spring break And our conversation was, what do we do with people that left the country or went to a hot spot? That was our discussion. But pretty much all along through the summer, we worked pilot summer schools. And what we found is that under certain conditions with limited number of students and wearing masks, that we could have some of our kids face to face. But I don't know that, particularly when we saw the onslaught of the variants and Delta where it's been, and we're just now over the last, 6 months or so in a situation where we're getting more and more of that 12 to 17 vaccinated, although it's not enough yet. And we're just beginning to work on the 5 to 11. Those are the things that are really going to let us be back in place to place or face to face. And some of our districts were able to do that, but they were able to do it with a combination of efforts. So I really don't think, as much as we'd like to have moved faster, I don't know that we could have. That's just my personal opinion.
A follow-up question this week is, school nurses were praised for their work last year, but how are they pivoting now with the latest vaccine approval for kids 5 to 11? And Kenny, I guess you mentioned, that these nurses and teachers are kind of pushed to the brink, many, stepping away. But, what's it like? Are they receiving a lot of phone calls from parents? Are they having to advise people? How has it changed, again, from this time last year to now that there's a vaccine involved at school?
Yeah, so our nurses and our nurse paraprofessionals are a vital part of what we do, particularly to keep some of our students healthy. I think they would tell you right now, as I listen to superintendents, 75 to 80% of their time right now is still going with COVID. Many times they're working with individuals that are sick. Parents have sent their kids sick to school. They go through the process. They find that they are a case. And then a lot of our nurses and our nursing staff are working with administration to do the contact tracing and helping with quarantine information. We would love to get to a day. The short answer is things haven't changed. We're not there where we need to be yet. We need to be able to pivot back where our cases are low enough and our vaccinations are high enough that when there's a case, we hand it back off to the health departments. And they do their work to coordinate with us. That's the day we look for. There's a lot of care that hasn't been given in hospitals because of COVID for whatever reason. People have delayed surgeries and that kind of thing. Same kind of stuff goes on in school.
We have a media question from Cake News in Wichita. Dr. Hawkins says, as the temperatures are getting colder in Kansas, what risks are there with COVID and the potential for a spike in cases? What are ways people can try and stop the spread, as they will likely be spending more time indoors?
Yeah, we heard a little bit with Kenny here today, and we've talked about this before. We certainly are concerned about that. We are always prepared for that here at the health system, and I know that talking with the other CMOs as well, as Dr. Stites has done. The other hospitals are also, we do anticipate and believe there probably will be further surge or increase in cases and thereby increase in hospitalizations. But the thing to do to protect you and your bubble or your family or your friends is to continue to do that individual assessment on the risk. And we know that there are higher risk situations, and those are situations where people are meeting indoors, especially if there are people around who you don't know, who, you have to assume there are people out there, number one, that have the disease and are still out in public because either one, they don't know it, or number two, they don't care. Also, you have to assume there are people out there that are not vaccinated. So you have to understand exactly what situation are you going into, what is that risk, what is your risk tolerance. But in those situations and in other situations, those non-pharmaceutical interventions continue to be vitally important. Masking, distancing, doing things in well-ventilated areas, and then, of course, vaccination. And so you have to really take all of those things into account. It's not black and white. There are degrees and shades of gray. And it's just understanding your risk tolerance and those at-risk situations that you are going into.
All right, Dr. Hawkinson, kind of going with the borax theme.
Yeah.
Brace yourself, because Cindy needs your help with this one. I've been having conversations with a friend about ivermectin treatment for COVID. Do the doctors have any suggestions on how to help convince them they should not use this to treat COVID? Have at it.
Yeah. Again, I think this goes also back to it is difficult when you don't understand where that person is getting their information from. If they are getting it from flawed sources, that is really going to be a problem. Also, is that person looking for information to support their opinions, or are they really getting their opinions from the true accurate sources? And I think there are a lot of different things there. And again, as we stated, there was another article this past week that was retracted from one of the journals because there was falsifying or inaccurate information really about the use and the benefits of ivermectin. And so that author, in fact, that's the second journal article that was retracted this year from that author. So I think it's really understanding exactly where that patient or that person is getting their information from, and then really dealing with specific questions about that. Again, certainly we know that ivermectin should not be used. It has not shown benefit. There are still, I think, at least 2 large trials to look and finally answer that question. But really, the bulk of the accurate and peer-reviewed data would show that there's no benefit from using that, from using ivermectin, either to protect you from getting COVID or during COVID treatment.
That's good advice, because I think people struggle when these conversations come up of like how to answer these questions intelligently and not just go, oh, that's ridiculous, or you shouldn't do that, but actually sending them to a reputable site and getting real information. So Peg has a question, and Kenny and Dr. Hawkinson, both of you grab onto this. There's a physicians group coming to KC that is opposed to vaccinating children, and she said they had made this statement: healthy children unvaccinated against SARS-CoV-2 are critical for achieving herd immunity. What are your comments on that? Dr. Hawkinson, I'll let you start.
Again, I think if these are physicians, it's probably time to find new physicians or listen to new physician sources. You can also achieve herd immunity through vaccination. You can achieve that herd or population immunity through vaccination or infection. Unfortunately, what we know from infection is that there are complications that go along with that. We've talked about that this week as well. Even though for the majority of children they do very well, they do not seem to have significant illness in the same preponderance that adults do or older people, they still can get severe illness. They still can die. They can still get long COVID. They can get that multi-system inflammatory disorder. And so that is not without its risks when you are just using infection. We also know that children can spread the disease to others, especially those that may be more at risk of severe disease. In addition, when children are infected, that also will hold them out of activities such as school, such as what we've talked about here. It is so important for children to be into school. So there are a variety of risks when you are just dealing with the infection. We know that the vaccination is safe. We know that your risk of getting myocarditis is much higher if you get the infection as compared to the vaccination. We know a lot of people are kind of continuing to use that as a crutch, but the data and the best scientific information would show that if you get the infection, you are at higher risk of getting that inflammatory heart condition than compared to getting the vaccine, especially in those younger children where we have seen that the highest rate of that myocarditis is really in those older adolescent males from about 15 to their low 20s as compared to those younger children as well. So I would again continue to seek out maybe other medical providers or pediatricians if those group of doctors are really kind of giving that message.
Kenny, I mean, we know that it's impossible to think all children are going to be vaccinated. That's not going to happen. So what numbers do we need to reach? How do we go about those efforts to get enough kids vaccinated in schools to reach that herd immunity? How do we tackle that?
Yeah, the answer is as many as we possibly can. I don't know what the percentage is, but if we follow where we, with the groups that I've talked about, we're only going to be probably in the 20s or low 30s of our children are going to be vaccinated over the next several months. Can I talk a little bit about herd immunity? And
Please
I'm not
do.
a doctor. I think Dr. Hawk did a great job of explaining that, but this is the way we've looked at it for my family. I've got a 4-year-old grandson, and we have all in our family that are around him are vaccinated to protect him. I don't want him to be the guinea pig out there to say, go out there and be a part of the herd and try to create the immunity. Oh, but by the way, if you get sick along the way, we're going to accept that, because we're not. I would rather say, if herd immunity is where we need to get to, let's get it through vaccinations, because that protects the individual. And it just seems to me when we talk about the herd, we're more worried and focused on the herd than we are the individual. I don't want to lose my grandson. And I don't want to be the one that makes the decision to say, it's okay because he's just working on herd immunity. Doc, I don't know whether that makes any sense or not, but that's the way we've rationalized it.
Yeah, absolutely.
Yeah, you don't want your kid to be part of that herd. Yeah. No, I'm glad you mentioned that. That hits home for sure. Lets us think about it in a different way. Another follow-up question today. Are there efforts underway to combine COVID vaccines with routine childhood vaccines like MMR? I don't know if it means doing it coordinating doing it at the same time or putting them all in the same shot.
Well, obviously you can get those different vaccines at the same clinic visit. That is certainly allowable and safe. Are you combining the components with each other? Again, MMR is a live vaccine. We have other childhood vaccines that are just pieces of the virus or the bacteria. Certainly there are efforts underway to combine vaccines into one. We know MMR, again, has 3 components in it. We know that Tdap has several components in it. We know that there is a Hep A and hepatitis B single vaccine as well. There are efforts underway to include COVID vaccines with other components of other vaccines as well, most notably influenza. But those are going on as well, so you have to get really less sticks or less jabs at those visits. But again, it is safe to get those multiple vaccine doses at a single visit as well.
Stacy wants to know, is the flu starting to go around? Where are we with those numbers?
I looked last week, and that data is always a week behind because of data gathering and analysis. But it is still very low activity around the United States. I think it was like 0.2% of positive of those tests that were done were positive, which is a very small number around the United States. But it looks like it might be creeping up a little. But currently, now is the best time to go get your influenza vaccine if you haven't. I think a lot of us are expecting a resurgence of influenza this year just because of what we've talked about. Less restrictions, no masking, things of that nature. So it is important. You still have time to go get it. You will have built up immunity within 10 days to 2 weeks, especially if you're going to be gathering here the next few weeks as well. So we do expect to have more influenza activity this year compared to last year. We would hope you wouldn't, but we have to prepare for that and expect that. So again, please go get your influenza vaccine.
Hey, Kenny, question this morning is, do you see school boards mandating the vaccine? Are you getting any response from parents as to if that was mandated, what their reaction might be? I was actually talking to a mom last night, and she said, just in case they mandate it, I want to get it on my own terms, so I'm going to go get it now before somebody makes me go do it.
Yeah, I think we're a long way from that. The vaccines that are mandated in schools are ones that over the years have proven to be effective and we know are extremely important for childhood disease. So measles, mumps, I don't know all of them. The good doc knows all of them. But when they come to school, they have to get a vaccine. It's mandated. So we've been mandating vaccines for a long time. We don't make the decision as school boards or as administrators or nurses that your child can't come to school if they don't get them. That comes to us from the higher ups, the health departments for the state, the CDC, and those people. So I think we're a long way from there being a mandate for vaccinations. I know that California has kind of been out on the front edge of that. And to my knowledge, I couldn't tell you, I'm sure there's consternation around it, but they've made it clear that students have to be vaccinated. And one thing, it's kept their extracurricular teams on the field, which everybody likes. Sometimes that's some of the focus that seems to be more important than reading, writing, and arithmetic. So, but I think we're a long way from that. And I think when it does come down, it's going to be similar to other vaccines that we have children get before they come to school.
Confirm this for Joanne. If all schools lift the masks mandates, won't children without the vaccine be the higher risk of getting COVID versus children who have had the vaccine? Makes sense.
Yeah, I always, because we always get blamed in schools, I always like to turn that. Wouldn't they be higher at risk in the McDonald's or in the Hardee's, not to advertise, or the Target or the Walmart than they would be in schools? I think the answer is yeah, they are. It's not just they're there at school, but they're out in the community as well. So it is across the community, not just our school.
Well, and again, we go back to school numbers have been relatively low, correct? I mean,
Yeah.
there's no
They've
place
been
I'd rather my
manageable.
kid be than being in a school.
Our people are managing COVID the best they can with the least amount of disruption so that we can ensure face-to-face instruction. And for what we've had to deal with, I believe they've done an excellent job.
They most certainly have. I'm going to get to a few more follow-up questions and we'll get to final thoughts. Dr. Hawkinson, if I get a positive PCR test and 2 days later I get a negative PCR test, which one's correct if I'm asymptomatic?
You know, I think with the sensitivity of the PCR test, you really shouldn't be redoing it or getting another PCR test. I would certainly, I think you have to, out of an abundance of caution, believe that first positive PCR test. Again, a lot of it has to do with the prevalence of the disease in the community. We know there's high prevalence of disease, and so therefore a positive result, especially on a PCR, would more than likely be a true positive result for these PCR tests. So I would believe that first result.
And can you comment on the decision to make masks optional for those 12 to 18? Kenny, just, you know, we think of this as being kind of a greater or a riskier group of folks. I know my kids are in elementary school. They just sometimes, anyway, do what they're told. But what are your thoughts about that age group not being masked in school? What kind of risk does that bring?
Well, we know what the risk is. Again, I think the decisions are going to be made around what direction we get from our health departments. Those are tough decisions, and I know they're under fire with their boards of directors just like we are. But again, we've tried to follow the recommendation of our health departments. That's a normal protocol. And this is what I'd say, if the masks are lifted, one, I'm personally going to encourage people, wear masks. If you're a student, you feel comfortable, wear a mask. If you're a teacher, you feel comfortable, wear a mask to protect yourself and others. But I think that this is where we need to continue to watch the data. Over the last 20 months, we're up and we're down, and we're up and we're down. And we can generally pinpoint what caused that spike, whether it was the variant or whether it was we went to colder activities or whether we got together for Thanksgiving. We can pinpoint that. And so the decisions that will be made, I think, will be made looking at all the information. But from that point on, we can't ignore the data. And if we've got to pivot back, we should pivot back.
I know you get a million questions, Kenny. I know you don't have all the answers, but thank you so much for sharing all of this with us today. I know it feels like we can't repeat the same questions a lot, but I know people have a lot of questions. So last follow-up question. Should someone, Dr. Hawkinson, who is vaccinated, then got COVID, still get a booster?
Yeah, we would still recommend that. You know, there hasn't been any real guidance on when. We know that there is no minimum time between infection and getting vaccinated, or in this case, getting that third dose or booster. When you are vaccinated, you will have an immune response so that when you get infected, you know, you will still develop an immune response specifically to that virus. So for right now, if you got vaccinated and then got infected, we would say, well, now you've been infected with Delta because Delta is the predominant virus variant going around right now. So you would have developed some sort of specific antibody response to Delta, but that immune response may have been blunted a little bit because you already have immunity. So I think really there is no specific time frame, but certainly you would get that natural infection boost after vaccination if you got infected. And certainly waiting several weeks or 60 days is certainly reasonable. There is no real guidance on that. We would encourage you to get that additional dosing. It's just a matter of timing. There is no specific guidance, but you are certainly, it is reasonable to wait, say 2, 3, 4, 6 weeks, 8 weeks. Unfortunately, there is just no specific guidance. We would, however, like you to get that booster at some point in time.
A lot of great questions today. Thank you, everyone, for sending those in. Let's get to our final thoughts. And Kenny, again, thanks so much for joining us on this Friday. What do you want us to know as we head into the weekend?
Well, we're going to remain vigilant, know that, and we're going to continue to have school. So there's a little solace in that. I would like to challenge any viewer or anybody that watches this after, or any of the news media out there, consider showing appreciation for your school people. It's a tough time for them right now. If you can reach out to a teacher or to a counselor or a librarian or a principal or social worker that's having to work right now with mental health issues with kids, but also our bus drivers and our cooks and our secretaries and the superintendent, let's not forget him or her, and the board members for the work that they do. Show the appreciation that you have for them. They're not hearing it much anymore, and they're dealing with all the issues. So it's always good to have somebody say, hey, we appreciate you. Thanks for the good work, and try to keep it up. That's my challenge to anybody that's out there.
Fantastic. I'm so glad you brought that up. That's the best advice of the morning. Thank you, Kenny. We appreciate you. We'll see you soon, okay? Dr. Hawkinson, final thoughts on this Friday.
Yeah, it is colder today. I think no better thing to do today or this weekend than to go get your influenza vaccine. And if you haven't been vaccinated against SARS-CoV-2, get your COVID vaccine this weekend. You can stay inside, stay warm, but mostly it will then start to provide protection, especially as we get into these colder months, into these gathering seasons, and really keep everybody protected.
You would say this might be a good weekend to bundle up and go take your kiddos to get vaccinated?
Absolutely.
All right.
Yeah.
So
anyone over 5.
Absolutely. So we've had people sending in photos. So keep those photos coming in. You can do that through Facebook Messenger or Medical News Network. Send your pictures of your kids getting vaccinated, all those thumbs up, those proud vaccination cards that they're showing off, and we'll show them right here on our program. And we've got a couple of those right now. So this came in from Ashley. She got their daughter Brianna vaccinated. Brianna is 9 years old and 21 days in counting until she is fully vaccinated. Arlene sent this in. This is their son Tristan, received his first COVID vaccine right there, holding up his card proudly. They watch us every day, and so we appreciate them doing that. They said they were, thank you for showing some of these kiddos on our program getting their shots, because it can be scary, which is actually kind of why we're doing this. We want people to see others getting their shot, to know it's not that bad. It's okay. Mom and dad will take you for donuts. They'll do all the fun stuff for you. So they can do it. You can do it. Get your kids vaccinated. And thank you for sending those photos in. Keep them coming. So thank you for being with us today. Don't forget, again, you can watch our show anytime on Facebook, our YouTube channel, and coming up on Monday. COVID, we know, has brought many challenges for kids, but they have stood strong, and now they are ready to take the shot. Russell is one of those kiddos, and he's going to get vaccinated right here on our program on Monday. He's going to show other kids how it's done. We'll also take a closer look at vaccination rates and efforts in Wyandotte County. The latest predictions as we head towards the winter months. Everyone, thanks so much for joining us all week. Have a great, safe weekend. We'll see you back here Monday at 8.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now everywhere podcasts are available.